Like to talk about the nose and paranasal air sinuses. So the human nose, it is the most protruding part of the face. So basically this nose is having two functions, that is, one is the respiratory function, the second function is the organ of smell. The receptors for smell are placed in the upper one third of the nasal cavity. So this part, it will be lined by the olfactory mucosa, whereas this is the respiratory mucosa. And the olfactory mucosa is comparatively thin and less vascular. The receptors are called the olfactory cells. So the rest of the nasal cavity, it is lined by the respiratory mucosa and it actually warms the inspired air. So here they are getting secretions from the serous gland as well as the mucus gland. So the serous gland, it will make the air moist, whereas the mucus gland, it trap the dust particles. So when the air is passing through here to the lungs, the air is getting moistened, the air is getting warmer, and it is getting cleared from the foreign particles. The nose can be divided into external nose as well as a nasal cavity. The skeletal framework of the external nose is bony as well as cartilaginous. So the bony part include, this is a nasal bone and this is a frontal process of the maxillary bone. So we have the septal nasal cartilage and the lateral process of the septal nasal cartilage. Then we have the alar cartilage. This is a major alar cartilage and this is a minor alar cartilage. So this region, it is supplied by the external nasal, infratrochlear and the infraorbital nerves. So now talking about the nasal cavity. The nasal cavity extends from the nares to the choana, posterior nasal choana. So this nasal cavity, it is separated into a right and a left half by a nasal septum. So only by removing the nasal septum we can see the lateral wall. This is the lateral wall of the nasal cavity. So each nasal cavity, it has a roof, it has a floor, it has a lateral wall and it has a medial wall, that is a septum which is removed. So it has a height of 5 centimeter and it also has a length of 5 centimeter and 1.5 centimeter width near the floor. So looking onto the roof of the nasal cavity, it is 7 centimeter long and 2 millimeter wide. So it actually slopes in front and it also slopes behind. The middle part is formed by the cribriform plate of the ethmoid bone, whereas the anterior part of the roof is formed by the nasal bone, the nasal cartilages and the nasal part of the frontal bone. The posterior slope, it is formed by the inferior part of the sphenoid bone. So now talking about the floor is formed by this is a palatine process of maxilla bone and this is a horizontal plate of the palatine bone. So this floor, it is slightly higher anteriorly than posteriorly and it is concave from side to side. The nasal septum, it is an osseo-cartilaginous part and it separate the two halves of the nasal cavity. Osseo-cartilaginous means it is formed by the bone and the cartilage and it is also covered by the mucosa and from the medial wall of the nasal cavity. The cartilaginous part is formed by the septal cartilage, whereas the bony part is formed by the perpendicular plate of the ethmoid bone and the vomer bone. The lower part, it is covered by the cuticular part. It is covered by the fibrofatty tissue and it is covered by the skin. The lower margin of the septum, it can be called as columella. The nasal septum, it is rarely central. It is either deflected slightly to the right or slightly to the left. So that deflection is produced by the overgrowth. So it is having four borders: the anterior border, posterior border, the superior border, and inferior border. It is having two surfaces, that is a right surface as well as a left surface. So now coming on to the arterial supply, this is a nasal septum which has been reflected. So this is the anterior ethmoidal artery, which is a branch of the ophthalmic artery, which is coming from the internal carotid artery. So this is the posterior ethmoidal artery. This is the sphenopalatine artery, which is a branch of the maxillary artery, and it is coming from the external carotid artery. This is a greater palatine artery, which is also a branch of maxillary artery that is coming from the external carotid artery. Then we have the superior labial artery. It is a branch of the facial artery which is also coming from the external carotid artery. It is giving septal branch. So you can see that the antero-inferior part of the nasal septum is a highly vascular area, and this area is called the Little's area, and the arteries which forms a plexus is called the Kieselbach plexus. So the arteries involved in the Kieselbach plexus are anterior ethmoidal artery, the sphenopalatine artery, greater the greater palatine artery, as well as the superior labial artery. So all the arteries involved in the Kieselbach plexus are branches of external carotid artery, except the anterior ethmoidal artery, which is a branch of internal carotid artery. So this is a region of epistaxis, that is bleeding from the nose. So the veins actually forms a plexus in the Kieselbach area, and anteriorly it drains into the facial vein, posteriorly it drains into the sphenopalatine vein, and then into the pterygoid venous plexus. Coming on to its nerve supply of the nasal septum, we have the general sensory nerves as well as the special sensory nerves. The antero-superior part, this is supplied by the internal nasal branch of the anterior ethmoidal nerve. The antero-inferior part is supplied by the anterior superior alveolar nerve. The posterior-inferior part is supplied by the nasopalatine nerve, which is coming from the pterygoid palatine ganglia. The posterior-superior part, it is supplied by the medial posterior superior nasal branch, which is coming from the pterygopalatine ganglion. The olfactory nerves are present in this olfactory region. So this is the lateral wall of the nasal cavity. Here three shelf-like bony projections are present. That is the superior nasal conga, middle nasal conga, and inferior nasal conga. So it increases the effective surface area and it warms the air which is inspired. The lateral wall of the nose separate the nose from the orbit from the above, the maxillary sinus from below, and the lacrimal sac and the nasolacrimal duct in front. The lateral wall can be subdivided into three parts. A small area in the anterior part, that is the nasal vestibule, which is a depressed area and it contains skin. It also contains short hairs, which is called the vibrissae. Next, the atrium of the middle meatus. This is the second part. Then the posterior part, that is the concha. And the spaces between the concha can be called as meatus. So this is the inferior meatus, this is the middle meatus, and this is a superior meatus. So the skeleton of the lateral wall, it is partly bony, partly cartilaginous, and partly by the soft tissues. So the bony part is formed by the nasal bone, this frontal process of the maxillary bone, then the lacrimal bone, then this is a ethmoid bone, the superior as well as the middle concha formed by of the ethmoid bone, and the inferior nasal concha, it is considered as a separate bone. Then we have the perpendicular plate of the palatine bone, and we have the medial pterygoid plate. The cartilage part is formed by the nasal septal cartilage and the major alar cartilage. So now talking about the concha, superior concha, middle concha and inferior nasal concha. They are curved and they are projected medially and downward. The inferior nasal concha, it is a separate bone. Then we have the middle nasal concha and the superior nasal concha, which is a part of the ethmoid bone, and this superior nasal concha, it is the smallest one. So talking about the meatus, actually they are passages beneath the overhanging concha. Each meatus communicate with the nasal cavity proper. Talking about the inferior meatus, it is the largest meatus, and the nasolacrimal duct is opening here at the junction of anterior 1/3 and the posterior 2/3. So the nasolacrimal duct, it is guarded by a valve of Hasner. The middle meatus, it is lying under the middle concha. So this is a bulla ethmoidalis, which is a rounded elevation. Then we have this hiatus semilunaris, which is a semicircular sulcus below the bulla ethmoidalis. At the anterior end of the hiatus semilunaris, we have a short passage, which is an infundibulum. So the opening of the frontal air sinus, it is seen at the anterior part of the hiatus semilunaris, and opening of the anterior ethmoidal air sinus, it is present behind the frontal air sinus, and opening of the maxillary air sinus, it is located on the posterior part of the hiatus semilunaris. So the superior nasal meatus, it lies below the superior concha. This is the shortest and the shallowest of the three meatus. It receives opening of the posterior ethmoidal air sinus. And we have the sphenoethmoidal recess. So this is a sphenoethmoidal recess. It is a triangular fossa just above the superior concha. It receives opening of the sphenoidal air sinus. This is a sphenoidal air sinus. It receives its opening. Then atrium of the middle meatus. This is the atrium of the middle meatus. It is a shallow depression just in front of the middle meatus, and above the vestibule of the nose. It is limited above by a faint ridge of mucous membrane, that is the agar nasi. So this is the agar nasi. The atrium of middle meatus, it is limited above by a faint ridge of the mucous membrane, that is agar nasi, which runs forwards and downwards from upper end of the anterior border of the middle concha. So coming on to its arterial supply, the anterior-superior quadrant is supplied by the anterior ethmoidal artery, whereas the anterior-inferior quadrant supplied by the branches of the facial artery. The posterior-superior part, it is supplied by the sphenopalatine artery, and the posterior-inferior part supplied by the greater palatine artery. The veins form the veins form a plexus which drains into anteriorly into the facial vein. That facial vein will drain into the pharyngeal venous plexus, whereas the middle part to the pterygoid venous plexus. So coming on to its nerve supply, we have the general sensory nerves as well as the special sensory nerves. So the special sensory nerves is the olfactory nerves that are distributed to the upper part of the lateral wall, and the general sensory nerve derived from branches of the trigeminal nerve are distributed to whole of the lateral wall. Now the lymphatic drainage. So the lymphatics from the anterior half of the lateral wall, it passed to the submandibular node, and from the posterior half to the retropharyngeal and upper deep cervical node. So next about the paranasal sinuses. So the paranasal sinuses are air-filled spaces present within some bones around the nasal cavity. So we have, this is a frontal sinus, this is a maxillary sinus, then we have the ethmoidal sinus. So all of them opens into the nasal cavity through its lateral wall. So the function of these sinuses are to make the skull lighter, to warm up and humidify the inspired air and add the resonance to the voice. And if there is infection to these sinuses, that is a sinusitis, the voice will be altered. So the sinuses are rudimentary or even absent at birth. So they enlarge rapidly during the age of 6 to 7 years. So from birth to adult life, the growth of sinuses is due to enlargement of bones. And in old age, it is due to the resorption of the surrounding cancellous bone. So now talking about the frontal sinus, it lies in the frontal bone deep to the superciliary arch, and it extends upward above the medial end of the eyebrow and backward into the medial part of the roof of the orbit. It opens into the middle meatus of the nose at the anterior end of the hiatus semilunaris. So this is the coronal section, and the right and left sinuses are usually unequal in size, and rarely one or sometimes both these sinus may be absent. So the arterial supply is provided by the supraorbital artery. The venous drainage is by the supraorbital and the superior ophthalmic vein. The lymphatic drainage is by the submandibular nodes, and the nerve supply is by the supraorbital nerve. Now talking about the maxillary sinus. So it lies in the body of the maxilla, and it is the largest of all the paranasal sinuses. It is pyramidal in shape with its base directed medially towards the lateral wall of the nose and the apex directed laterally in the zygomatic process of the maxilla. It opens into the middle meatus of the nose. So this is the into the middle meatus of the nose. This is the opening of the maxillary sinus in the lower part of the hiatus semilunaris. The opening hiatus is nearer the roof. In an isolated maxilla, the opening or the hiatus of the maxillary sinus, it is large. So its roof is formed by the floor of the orbit, and the floor is formed by the alveolar process of the maxilla and lie above 1 centimeter below the level of the floor of the nose. So the arterial supply of the maxillary sinus is by the facial artery, infraorbital artery, the greater palatine artery, whereas the venous drainage, it drains into the facial vein and the pterygoid venous plexus. The lymphatic drainage is into the submandibular nodes, and the nerve supply to the posterior superior alveolar branch from the maxillary nerve. Now about the sphenoidal sinus. We have a right and left sphenoidal sinuses that lie within the body of the sphenoid bone. They are separated by a septum. Two sinuses are usually unequal in size. Each sinus opens into the sphenoethmoidal recess of corresponding half of the nasal cavity. So each sinus, it is related superiorly to the optic chiasm and the hypophysis cerebri. Laterally, it is related to the internal carotid artery and the cavernous sinus. So the arterial supply, the posterior ethmoidal and the internal carotid artery will be supplying, and the venous drainage, it drains to the pterygoid venous plexus and the cavernous sinus, which is nearby, and the lymphatic drainage to the retropharyngeal nodes, and the nerve supply the posterior ethmoidal nerves. Now about the ethmoidal sinus. Numerous small intercommunicating spaces which lie within the labyrinth of the ethmoid bone. It is the ethmoidal sinus. So they are completed from above by the orbital plate of the frontal bone, behind by the sphenoidal concha. Anteriorly, we have the lacrimal bone, and the sinuses are divided into anterior, middle, and the posterior part. So this is the anterior. We have the anterior, middle, and the posterior part. The anterior ethmoidal sinus. It is made up of 1 to 11 air cells. It opens into the anterior part of the hiatus semilunaris of nose. It is supplied by the anterior ethmoidal nerves and vessels. Its lymphatics drains into the submandibular node. Then we have the middle ethmoidal sinus. It consists of 1 to 7 air cells. It opens into the middle meatus of the nose, supplied by the anterior ethmoidal nerve and vessels and the orbital branch of the pterygopalatine ganglion. Then we have the posterior ethmoidal sinus, consists of 1 to 7 air cells. It opens into the superior meatus of the nose. Superior meatus of the nose. And it is supplied by the posterior ethmoidal nerves and vessels. So what is the applied of these sinuses? So if there is any infection of the sinus, also known as the sinusitis, it causes headache, then persistent, thick, purulent discharge from the nose. So if there is a fracture of the cribriform plate of the ethmoid, with the tearing of the meninges may tear the olfactory nerve rootlet. In such cases, CSF may drip from the nasal cavity and it is called a CSF rhinorrhea. Then here will be the Little's area on the septum. It is a common site of bleeding from the nose or epistaxis. So that's all about the nasal cavity and the paranasal sinus.